Hey everyone, it's Dr. Andrew Wolf here with Health Ed Solutions, and today's lesson is an introduction to a series of videos on the assessment and diagnosis of abdominal pain. Don't forget to visit us online at healthedsolutions.com for more free content. Now let's get started. This series of videos will include this introduction, an overview of the anatomy and physiology of abdominal pain, taking a history of a patient with abdominal pain, the physical exam of abdominal pain, diagnostic testing, and the diagnosis of abdominal pain. So that will encompass the entire series. Acute abdominal pain can lead to critical illness, and a skilled clinician needs to be able to differentiate emergent causes, confirm diagnoses efficiently, and manage them effectively. So to start, I'd like to talk about 7 of the most common diagnoses that we see with a patient presenting with acute abdominal pain. So the first is renal colic. And that is caused by kidney stones obstructing the ureter on either side. A urinary tract infection. I can just kind of draw on the bladder here. So number 2, UTI. Number 3 would be gallstones, and you can see the gallbladder there. Number 4 would be acute appendicitis. And we'll draw in a little appendix there. Number 5 would be diverticulitis. Number 6 is acute pancreatitis, and you kind of see the pancreas peeking out here. The rest of it would be here. Or you can actually see it up here. It's a retroperitoneal organ. So we'll talk about the anatomy in the next video, but number 6 is acute pancreatitis. And number 7 would be a colitis from viral or bacterial infection or inflammation. So those are sort of the most common causes. There's also a number of do not miss diagnoses, and I'm not going to go through them all, but it's we will talk about them as we go through the rest of the videos, but there are a number of potentially life-threatening conditions that you do not want to miss. Some of them are included with what we've mentioned here. Gallstones, biliary colic is a cause of pain. It generally doesn't lead to an emergent condition. However, if there is a severe inflammation, cholecystitis, that can be a life-threatening condition. Same with cholangitis. Pancreatitis is a do-not-miss condition because it can be quite extreme. Appendicitis is, and actually appendicitis is worth mentioning because it is, of all of the do-not-miss diagnoses, it is the one that is most often missed. So I want to kind of emphasize with appendicitis, it's very important to kind of keep the differential in mind. It can look very differently because this tip of the appendix can kind of vary in location. There's just various normal anatomical differences between individuals. So each anatomical variation where this tip lies sort of presents a different pain syndrome. The other thing that's important to be aware of is there's certain things that can cause us to be misled commonly with their sort of confounders that are very frequent. One is the presence of constipation. So with appendicitis in particular, but also with other causes of pain, if a patient presents with constipation and abdominal pain, we often miss the primary cause of the abdominal pain and assume that it's constipation. So if you have a patient that's presenting with severe abdominal pain, and also constipation. Just keep in mind that they may have constipation and something else, so don't stop looking there. That is the most common reason why appendicitis is missed. Also, other confounders include gender. Women are misdiagnosed more frequently than men, or diagnoses are missed more frequently than men. Mental illness and addiction. So if you have a patient with any of these conditions presenting with abdominal pain, you need to sort of stop and think, use metacognition, think about your thinking, and really sort of stop and slow yourself down and think about what could be going on. Ask yourself if there's any alternatives to what you think may be going on. So if you're making assumptions that it may be constipation, or that it's like drug-seeking behavior because of a history of addiction, stop and think and say, can this be something else? So in our next video, I'm going to go over the anatomy and physiology of abdominal pain. That's it for our lesson today. Thanks for watching, and don't forget to please like and subscribe below.